views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, I'm the Dr. Bob Lee. Welcome to Open BxRx, our special coverage of COVID-19, also known as the coronavirus, and how it's impacting our community and beyond. Coming up on today's show, as parents around the city struggle with homeschooling, we'll meet two college students from Columbia University that have created tutoring programs to assist our students. Plus, we'll learn about a mentoring program for families and youth. They're being provided during this time. And then after that, we'll hear about a local doctor with an update on telemedicine, the health impacts, and more. Then Bobby C has the latest on the impact of coronavirus in the world of sports. Then later on, we'll take a look at what one community group is doing to make sure people in the borough have groceries. So stay tuned. All this and more is headed your way. We are now open. Welcome back. Amid the coronavirus pandemic, the Bronx is seeing an alarming fatality rate compared to other boroughs. Joining us to share more about the impact of the borough, we have Dr. Vanessa Salcedo of the Union Community Health Center. We welcome you to the show.
Thank you, Bob. A pleasure to be on the show.
Why are we seeing this in the Bronx? Why is it so high, the fatality rate?
Yes. Unfortunately, it's really devastating for me as a pediatrician, a community doctor, health promotion doctor in the Bronx. These numbers, to me, mean not only numbers, but they actually mean people from our community, my patients, our families, and that's really devastating for me. Yeah. But unfortunately, it's not surprising to see these numbers as a health professional. Bob, as you know, the Bronx ranks number 62 out of 62 in health outcomes. Yeah. And I know a lot of our viewers know this because you guys talk a lot about this, that what that means is that we have the highest rates of diabetes in all of New York State. We have the highest rates of these chronic diseases that make our community vulnerable. So that's why we're seeing these numbers and these high fatality rates in our community, because we are the most vulnerable community in all of New York State.
So it is the degenerative diseases like diabetes and asthma and things of that nature?
Yeah, so diabetes, asthma, hypertension, COPD, any autoimmune disease like HIV, cancers, these are the unfortunately, the illnesses that our community suffers from in high numbers. And unfortunately, these are the victims from COVID also.
So what can people do in our community to try to head some of that off?
Yes, so, as one of my roles is Director of Wellness and Health Promotion, and health promotion means prevention. Yes. So for this brand new virus that we know very limited things on, what we do know is how to prevent it. And we've been trying to be very proactive and really trying to reach our patients and our community to tell them this message that we're hearing over and over again, to stay home to stop the spread. The first thing we really need to understand is to stay home, especially the vulnerable population that we just mentioned. Yeah. I know it's hard because, in the Bronx we suffer from, overcrowded dense populations. Our apartments are small. It might be multiple family generations, so it's difficult for us to stay home. But it's really important because community transmission is very high. So what that means is that the virus is everywhere.
Yeah.
And you can't really see it, or things you touch puts you at risk to touching the virus and then transmitting it to yourself or other people. So staying at home is the first and most essential thing to do. If you do have to go out, we recommend for not a vulnerable population person or anybody suffering from these illnesses to help their community members or their family members to get groceries, or somebody in friends and community to get groceries, and really limit that exposure for that person even once a week. Just to limit the exposure, going outside as minimal as possible. So that's number one. That's number one. Stay home. Number two really is if you do go out, you have to cover your face, whether it's with a mask or a scarf, and make sure to cover your nose and your mouth when you do go out to protect yourself and protect others. Because another thing that we're talking about, and we're learning more, since I mentioned this is a new virus, we're learning more that there's what they call asymptomatic carriers. And what that means is that there's people out there that have corona and have zero symptoms. Yeah. So you don't know you have the symptoms, but you're spreading it to the vulnerable population in our community. So that's why it's really important for everyone to stay home, because you don't know if you're that person spreading it to others. So, second, if you're a healthy person or you think you don't have corona and you have to go out for something essential, wear a mask. So that's number two. Yeah, so number one, stay home. Number two, wear a mask. Number three, the most important thing of them all is wash your hands. I know we've heard this enough, and we know we've heard this a lot, but washing your hands is extremely important. It has to be at least 20 seconds. Like I said, if you must go out, wash your hands before you leave the house, wash your hands when you come back, wash your hands as much as you can. If you don't have a sink nearby, sanitize. So number three, wash your hands. So those are the top three things our community really needs to focus on and do to help prevent the spread of coronavirus to our vulnerable population.
Doctor, is it airborne? Should you wear goggles? You go to some places and they have the shield and everything over their faces.
Yeah, so that is a great question. Like I mentioned, this is a brand new virus. We're learning as we go. We definitely know that it is aerosolized with certain procedures, like intubation when somebody has to be put on the ventilators. So it is in the air for a little while in these really rare occasions. And, so we wear the goggles or the eye shields. Why we do it the most is for two reasons. If you touch your eyes, I think at the beginning everybody was talking about rubbing your eyes and not touching your face. And that's why, because the virus enters through your eyes, your nose, and your mouth. Yeah. So if you actually, Bob, you even may come up with a fourth recommendation. If you must go out, wear sunglasses or wear your glasses, because that will protect you even more from touching your eyes.
Anybody talking about toilet bowls? Because it enters through the mucous membrane, and people sit down and go to the bathroom. They are talking about toilet bowls. Bob, you do bring up another good thing. So disinfecting your house as much as you can, because you can be that person that maybe doesn't have symptoms, or you might have mild symptoms. Mild symptoms do include diarrhea.
So
Yeah.
you've noticed that you've had diarrhea lately and you don't have anything else, or you've heard about you can't smell. Some people are saying they can't smell.
Yeah.
That might be one of the super mild signs of corona, and you have to think about being extra cautious and really disinfecting. So we do recommend to disinfect the house as much as you can, like high-touch surfaces, which includes doorknobs. We touch doorknobs all the time. Toilet handles, sink knobs, and we just say as frequently as you can, as much as people touch them, to really wipe them down.
Yeah, and you have to find new ways to be creative, because if you try to go buy alcohol or Lysol, a lot of those things are not on the shelf anymore.
Yep, not on the shelf. There's really great videos on YouTube now, how to make your own hand sanitizer with alcohol, with just regular alcohol and aloe. So that's one way you can make your own hand sanitizer. But Bob, honestly, the best thing to disinfect your hands is washing your hands.
Wash your hands.
That's more effective because you're rubbing it for 20 seconds with soap and water. And the last thing when it comes to killing the virus is the good news is that this virus is very fragile. It's not a very strong virus on surfaces. So if you wipe it down with like any regular household item, it's going to die.
Yeah.
So these are things that we really need to tell the community that, yes, of course, if we have the Lysol spray or the hand sanitizer, that's great, but we do have alternatives that are just as good if you use them correctly and use them frequently.
That's good. Doctor, finally, how are you guys changing the way you do business or the way you see some of your patients at the center?
Yes, like I said, the first thing we did was call our patients to tell them about these recommendations, and the first one is to stay home and to not even see us. We want to talk to our patients over the phone, and if we feel that's something urgent, we'll tell you the next steps. If you need your medicine, we'll deliver them to your house. We'll have pharmacies that we partner with, that we deliver pharmacies to your house, because we really want to make sure that the community is staying home, but we really also want the community to know that we are here for you 24 hours a day. Just because we can't see you doesn't mean we're not here for you. So you could call us 24 hours a day during, whenever, and you can talk to a doctor. If you have a simple question or if you're having symptoms, call a doctor and we'll help you through the next steps. Yeah.
Would you like to give a website or the number?
Yes, of course. Yeah, so you could call Union Community Health Center at 718-220-2020, or you could go on our website to find specific, hours of operation. And all this information on COVID is also on our website. And our website is uchcbronx.org. uchcbronx.org. And one of the last things is that, the great thing is being part of a community health center. The great thing is that we don't turn anybody away. Excellent. So it's really important that, whatever your insurance status is, your immigration status is, that as a community health center, our mission is to serve everyone and not turn anyone away. Because especially in times like this, we really want to help our community not get sick and really stay together and help each other.
Doctor, thank you so much. Dr. Vanessa Salcedo of Union Community Health Center. Thank you so much. We appreciate you, and thank you for your service.
Thank you.
Stay safe. We love you.
We love you too. Take care. I love my community. Bye-bye.
Bye-bye. We'll take a break. I've got more next. All right, welcome back as we continue with distance learning in New York City schools. Our next guests have created a virtual tutoring service for students and parents through the homeschooling process. And we welcome Anna Beloborodova. She's the co-founder of Hearts Over Hands, and also Diane Huang. Welcome, guys. Welcome to the show.
Thank you. We're so excited to be here.
Heart Over Hands. Tell us a little bit about it.
Well, Hearts Over Hands was started to help alleviate some of the pressure that parents are under during this outbreak of COVID-19.
Yeah.
So yeah, we're both university students, and when we came home, life kind of came to a standstill. So we both found ourselves with so much time on our hands, and we just wanted to do something to help out.
Well, this is how it all starts. Right? University students, what school?
Columbia.
All right. So you kind of got together and you said, let's do something. We need to do something virtually. And so how did it all happen? You guys sat together and what happened from there?
Well, it started with me kind of building out the website to see how could this actually work in practice. Yeah. And started sharing that on social media, and we just received an outpouring of support from classmates and from parents and just a lot of interest in general. So from there, I kind of picked it up. Diane joined the team, and we've been working on it ever since.
Diane, talk about the virtual services that you guys provide.
Yeah, of course. So our platform is hosted almost entirely on Google Calendar. And the way that it generally works is that we set up a Google Invite or Google Calendar event with our volunteer and our parent. And from there, they meet on a weekly basis, once or twice a week. And just through video, just exactly on this Google Meets platform that we're on right now. And from there, depending on what the parents want from their volunteer, whether it's younger children and they want just sort of socialization, or if it's middle school, high school students that need help with homework, the volunteer will just work with the child on whatever they need. So sometimes we have math tutors that will help students and children with their math homework. We've had computer science students, and of course, essays and other projects.
All right, so you guys are working it out. You came up with this service so that you can, help others get what they need. So, but what's gonna happen after this? I mean, after the pandemic.
So, we did create it in response to the pandemic, but we're getting a lot of feedback from parents in general saying that they're finding this really helpful, and kids seem to be enjoying it. And, so if it's something that there's a need for afterwards as well, then we'd love to keep it around. And
I can see a need for it. I mean, you got to keep it going. You got to keep it going.
Yeah, for sure.
Yeah, this is a brand new baby. What age groups can use this service?
So we strongly encourage for kids ages 7 and up. So far, we have a majority ages 7 to 16.
And Diane, did you guys come up with a cost yet, or is it free?
It is completely free. All of our volunteers work at no cost. Anne and I work at no cost, and we currently operate on donations.
There you go. So you need donations.
We do need a little bit, but our overhead cost is not too large.
All right, so I'm going to ask that I'm going to give you the platform here. You can ask for what you want. You ready? Who wants to go first? You guys can do it together.
I mean, what we want most is just getting the word out there, getting people in front of parents who could use the support, getting people to sign up, and that's most of what we need right now.
Yeah. But you need funds. So where do the funds go to?
Yeah, go ahead, Diane.
Sure. So just a list of some virtual platforms we use. Primarily, we use Google Suite. That's fairly low cost at the moment. We also have our website that we host, and then some other small organizational tools. But mostly what's been important is just connecting volunteers to parents.
All right, that sounds good.
Yeah, and just a note about our donations that everything that's in excess, we are now like working on making a list of some charities that we'll donate to at the end of every month. Anything left over that doesn't go towards running Hearts Over Hands.
What's the vision? Where do you guys want to see this going from here?
So currently, we just recently opened up our volunteer sign up to universities all over the United States.
Oh.
Every week we approve new universities. So obviously, one of the questions that I'm sure parents have are, how do you make sure that these are actually university students? So the way we approve universities has been whether or not they have public student directories for us to verify.
Yeah.
So we're really hoping, obviously, that we have the service that it gets to the people that need it. So our hope is that we'll start getting more parents signing up and more university students all over the country rather than just sort of on the East Coast right now. We have a handful from the West Coast, and we're getting a lot more volunteers from there as well. So we're really excited that we're expanding, nationally.
Yeah. Bravo. We love what you're doing. Website. You have a website where we can go and check it out?
Absolutely.
On it? Yeah.
Absolutely. Go to heartsoverhands.org. It's all there.
Heartsoverhands.org. Thank
Yep.
you so much. Anna Beloborodova, co-founder, Hearts Over Hands, and Diane Huang, co-founder. Thank you guys so much. We love you. Thank you for all the work that you're doing. Keep going strong and stay safe. All right?
Thank you so much.
All right.
Stay safe. Be well.
Thank you. We'll take a break.
Okay,
I've got
thanks.
more next on Open. In partnership with WFUV, reporter Natalie Migliore explores the financial impact many Bronx residents are facing. Let's take a look.
With coronavirus putting life on hold, some families have to adjust their budgets. I'm joined by Kathy Clarke and Jumelia Abrahamson, who work with University Neighborhood Housing Program. Thanks for joining me.
Thanks for having us.
Thank you for having us.
Great. So what programs is UNHP offering people through COVID-19?
So before this crisis happened, the Northwest Bronx Resource Center offered a wide range of housing and financial services. And for the most part, we did those face-to-face and in group settings. Obviously, we can't do that now. But the good news is there is a lot that we can do remotely through email and on the phone. First of all, our phones are working and people are answering our phones. So I think that's a great first step. Our number is 718-933-2539, and people can reach out to us and speak to someone. The other thing that we're doing is we are working with seniors and people with disabilities to freeze their rent. We're connecting people with one-on-one free financial counseling. And we are working with people that have the Housing Connect accounts, which is New York City's online affordable housing lottery, to update for new lotteries. But I think the biggest thing that we're doing is answering our phone, providing information to people on a wide range of services. And just yesterday, we started doing wellness calls to the seniors who used our programs, 300 of whom we know don't have access to internet or email. So we're checking in on them, seeing if there's anything we can do to help. And in the next week, I think we're going to start reaching out to people who've used our housing services and work with them remotely on the phone to help them take the next step.
Yeah, that's very important, making sure that we're checking on the most vulnerable in our communities. But how can one-on-one financial services help New Yorkers, especially during this time?
Well, financial counseling, it's always so important, and I can't stress that enough. But before I talk about that, I just want to say how glad I am that we're having this conversation as a reminder that this will end. The crisis will end, and we need to plan as a hopeful way to look to something else in the future. And that's what financial counseling provides. It reminds us that we can prioritize, that we can make plans, and that we can bring other people into those plans that can help us achieve it together, that we're not alone. So at UNHP, we've always seen financial counseling at the core of all of our services. If it's housing, if it's taxes, if it's rent freeze, because once we know that an individual is working with a financial counselor, that they'll reach financial stability. And during times like these, we see that health and finances go hand in hand. So once we have this plan in place, it helps us reduce our stress level. It helps us have an ability to buy necessities like food and medicine. It helps us pay our bills, like the rent that's always lingering. So it gives us this sense of control, and it helps us understand what's coming in and where we're actually spending our money. So that's why at moments like these, we should be reminded that we can access financial counseling, and the city has a range of financial counselors available. UNHP works with 2 different partners. And as Kathy mentioned before, these counselors are available for phone session, virtual Skype sessions, through texting, to help people understand what they can prioritize, what they have to pay first, what can wait, help them create a plan and communicate with lenders so their credit is not affected. And it also provides that support that they may need during stressful time like these.
Yeah, that's super important, especially for people who aren't sure where their next paycheck is coming from or where this is going to lead. But what needs to be done for hardworking families right now who are sometimes essential workers getting paid minimum wages?
Yeah. So that's an issue that's been around for a long time, especially in the Bronx and in low-income communities in New York City. The Bronx has the lowest per capita income, and it's been that way for a while. Wages, even with recent minimum wage increases, just have not kept up with expenses, especially rent, which has really been increasing very significantly over the past few years. And this mismatch between wages and rents is really the foundation of the affordable housing crisis that we're in right now and the rise of homelessness. It's interesting that this moment has really shone a light on the essential workers who really earn so little. And yet, right now, they're keeping us all afloat by delivering packages, working in grocery stores, taking care of the elderly in their homes. You know, in our tax program, we see both home health aides that work in people's homes, as well as people who work for hospitals that are unionized. And it's more than just wages, that's the difference. So having paid sick leave, having medical benefits, having the opportunity for increases in the wage really is also part of that equation.
Yeah, definitely. And but particularly right now, as we're going through it, what should people keep in mind when it comes to financial planning during this time?
Well, I think definitely people should focus on their health, continue to do that. And while sheltering in place, they should make this plan, a financial plan. They can create a vision board. They can get creative, visit Pinterest and different apps. And they can bring the family together to start talking about what goals do they see themselves creating in the future. Could it be paying debt or sending someone to college or themselves or buying a home, or just something as small as opening a bank account for a family member that may be unbanked, or for the younger members of the household, starting a piggy bank of some kind, or just instilling these conversations about money, which sometimes in many of our households, especially the household that we work with, and I myself come from a Hispanic household where money sometimes is a taboo. Like, people don't talk about how much money you make or how you're spending it. And usually until there's a crisis, these topics don't come up. So we should use this time to have these conversations and be preemptive so we can prepare. And in the future, we're not so stressed when situations like these arise.
That's great advice. Well, thank you both for joining me so much. Hopefully this is some sort of help for all New Yorkers going through sort of a stressful time. Be sure to check out UNHP online. They've updated their website with a COVID-19 guide. It has resources for health, housing, finances, and food in the Bronx and citywide. Thank you so much for joining me today.
Thank you, Natalie.
Thank you, Natalie.
Thank you, Natalie. We'll take a break. I've got more open coming up next.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
All right, our next guest is the founder and CEO of iRaise, a program providing mentoring, tutoring, college prep, and more. He joins us today with a look at their work and the COVID-19 petition. There's a COVID-19 petition, and we welcome Shanequa Moore to the show. Tell us about that COVID-19 petition.
Yeah, so first of all, thank you so much just for having me today. I'm really excited to be here and just share about the work that we're doing.
Yeah.
And so our COVID-19 petition really is finding a way to advocate for our children and our families in New York State. As you know, New York State children have been impacted greatly by COVID-19. And I know this goes across the board in the US, but specifically for our New York children, they're dealing with a lot of trauma. This being the state with the highest amount of deaths from COVID-19. Our kids are trying to adjust to remote learning. They don't have after-school support. They don't have and classroom support. And they're really just trying to process everything going on. And so the COVID-19 petition just urges our state leaders to take that into consideration and to provide crucial social supports and mental health services specifically for children in New York State so that they're able to get through this very difficult time in this world pandemic.
Mental health services. It's
yes, virtual.
Because this is going to hurt a lot of people mentally.
Right. Yeah, and it's actually hurting a lot of our kids now. Right now, we work with a lot of children and families. We provide these virtual services to them, and our kids are afraid. They're afraid to go to the mailbox. They think they're going to catch coronavirus. They're afraid of what's going on. Some of them just don't know how to process everything, you know? And the fact of the matter is some kids are going home and they're not in safe environments, which means that there's an increase in child abuse cases and domestic violence cases, and we have to be able to provide the support for them while they're going through all these things.
And it's hard to keep people, at home all under one roof at this particular time. You know how difficult it is for you. I mean, how's it for you?
It's been really tough. So it's been tough. I'm a mom. I have an 8-year-old daughter, and she's sitting here right now. And I, it's hard. She wants your
attention while you're on, right?
Yeah, she definitely does. But I gave her some chocolate, so she's quiet right now. Bribing. But it's hard. Some parents, they're sharing. Some households, they don't have multiple tablets to be able to engage in remote learning, and some people have multiple kids. Being in a house all day, social distancing, not being able to take your kids to the park, it's really hard for parents. It's hard for children.
Absolutely. What kind of virtual services are you providing at this time?
So we have a virtual youth mentoring program, and it's a really great program because it gives children opportunities to interact with each other, to build social connections with peers and friends, to make new friends online, and they're actually matched with a mentor specialist through our program. We have about 50 mentor specialists that are working with kids, and this program is actually great because it's open to kids not just in New York State. And we also have online parenting classes for parents just to adjust through these difficult times. And so those are our programs now. We're in a process of launching telehealth mental health services for children, and we're in a process of trying to get a COVID hotline for children and families.
And this is all virtual, of course.
Yes, now, absolutely.
The parenting classes, what do you offer? How does that look?
So the parenting classes, they can sign up online through our website. Once they sign up, one of our representatives will contact them, and we'll be able to intake them and once they are registered into the program, they engage in weekly parenting classes, teaching them how to adjust self-care, stressors, how to deal with all of these things while, during this world pandemic. And that's what it's really geared to, helping parents, helping them to have the relief and the support, and also looking for emergency services for them. Some of them don't know how to navigate and find those emergency services. So if they're dealing with a financial hardship, or, they need healthcare access, we're able to provide them with that case management services too.
How do you think this is all going to pan out? How do you think this pandemic is going to pan out?
Yeah, it's hard to say. I think we all are, just trying to figure that out. But I think what's important is that we are just doing as much as we can to be preventive, in terms of alleviating as much as we can the stress and the overwhelmness of this situation, and just being there and remembering that we're all in this together. We're all going through this. Like, I think we can all attest to the things that are happening. Everyone is feeling it together. And so we don't know how this is going to play out, but it's important that we have each other and that we remember that.
Yeah, and I'm glad you have some of these things in place with your organization. When did you start this organization, and what were you doing before?
So we actually were founded in 2013. I founded it just as a need for the community to have a program that caters specifically to at-risk youth. I think it's important. Me being a person that grew up in New York City, I grew up in the Bronx. I went through New York City public schools, and I come from a home that, would be considered dysfunctional, where, I had to deal with a lot of different things. And so coming from having that experience and then being able to come out of that, I wanted to provide a program to the community that was able to help young people go through experiences like I did. And so, that's how it started in 2013.
Yeah. That's good. That's good. I'm glad you started the program.
Thank you.
So tell us more about this petition. Where do you want it to go? And what else do you have to do? What kind of help do you need to move it along?
Yeah, absolutely. Thank you for that. So the petition, you can actually, we are looking for at least 1,000 signatures. Right now, we're a little over 100, and we just released the petition to the public 2 days ago. So what people can do to help out and to stand up for New York State children is sign the petition. The petition is going to go to New York State Governor Cuomo, New York State Carl Hetty, our New York State Speaker, and also our New York State Senate Andrea Stewart Cousins, Majority Leader, and these will be sent to them through email. We're also going to be attaching signatures, and we're actually urging them to divert these funds into nonprofit and community-based organizations to be able to provide these crucial services. And the reason why we're saying the nonprofit and community-based organizations is because these are the ones that have been providing services to our kids prior to this. So it would only be fitting that they continue providing these services virtually.
Yeah, like what you're doing. Is there a website?
Yeah, so they can sign up for the petition at www.iraiseinc.org. Right in the front of the homepage, you'll see the petition up there. They can click on it, and it'll lead them right into our page to sign up for the petition. Yeah. It's really easy. It takes like 1 minute, and they can share it with their friends and family.
Shanequa Moore, CEO and founder, iRaise Girls and Boys International Corporation. Thank you so much for joining us.
Thank you so much for having me.
Everything. Yes.
Thank you.
Okay, stay safe.
Okay, you too.
We'll take a break. I've got more on Open next.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College. And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv. Learn, engage, inspire. BronxNet TV. From the Bronx
to the world.
BronxNet.
Hey, sports fans, joined today by a longtime friend, the co-CEO of Hoops in the Sun, Randy Cruz. Randy, how are you doing?
Obviously, my man, how you doing? Doing good.
Doing all right, living life at home these days, working from home. So a little bit of a different thing. I think the only thing that has been maybe a positive, as much as I love to get suited up these days, I do enjoy kind of working in my pajamas. I've tried to get a little more fashioned up for you today. I got a little spring jacket on.
Look nice, man.
Yeah, thanks, man. Definitely missing being outside as much, but as we know, New York on pause. It's probably best right now to stay indoors and stay home. But how's everybody at home? Speaking of family and health, and how's everything going at home?
Family's doing good. Taking everything one day at a time, just trying to kind of process everything and trying to adapt to the new way of, life right now, the new norm. Just being extra careful, staying at home majority of the time, go outside probably for a little walk and not try to be around as much people as possible. So still getting used to it, but hopefully, this can all, pass by sooner rather than later.
Now, Randy, you're a big-time Renaissance man. At least that's what I call you, because not only are you the CEO of a very popular playground basketball tournament here in New York City, and that's Hoops in the Sun, over 20 years at Orchard Beach, but you're really a terrific content creator. So in this time of the pandemic, you've been one of the few people, I think, that has done a marvelous job of creating content, especially basketball content, and you're doing that through the platform of podcasting. So you've got some new news because your podcasts are on a different platform, and I was hoping that you could share it with the fans at home as to what you're doing and how you're keeping busy these days.
When you're home and you think a lot, you try to find different ways how you can just curate something, whether it's video or podcasting, or how you just tweet online on Twitter and just or Instagram live videos. So my brother and I have been doing that lately. The podcast, I think it's going really well. It has been on a new platform on Ball's Life for the past 2 months right now. So it's still growing. I think it has a lot of room to grow. Potential shows coming up in the next couple of weeks, and I'm a very big time throwback nostalgic NBA fan, as you know. So at one point I was getting tired of talking about the same current NBA stuff with LeBron and Harden and the Warriors and all that stuff. And it's like I felt there was a space where you could talk about retro throwback basketball once a week and have people who follow me on Twitter and vice versa just come on, and people who cover the sport for a certain team or for a certain website to come on and talk about what team they were a fan of growing up, or what team they're a fan of now, what player, what certain era are they really fans of. And I just did that. I reached out to a few people, and we did one show, then it became two, and it was something that I wanted to curate over a year and a half ago. So we're about 30, 35 episodes in, I believe. Just creating content. My brother is doing some things on Instagram Lives just to kind of pass the time and just trying to talk to people in the basketball world, especially the street ball world, because we don't know what's going to happen this summer as far as every major street ball tournament goes. So not just only us, but it's a major question mark, and just trying to figure out a lot of plan A, B, C, D, how to move forward with everything.
I really enjoyed the show that you did with Ron Artest recently. And of course, Ron, not only a college and an NBA star, but one of the former stars of Hoops in the Sun.
Yeah, so my brother, quick story, he went to school with Ron Artest and Shamgar Wells back in LaSalle in the mid-90s. So they always kept in touch with each other. Shamgar's now with the Mavericks doing player development work. And my brother was just on Instagram one late night, and he said, I'm going to try to get Meta on the show. And I said, okay, cool. Like, what, for, IG Live? He said, yeah. And me thinking, he'll probably be 10, 15, 20 minutes. He's doing a whole bunch of things. But we had him on, like, on a Monday night, a week and a half ago, 2 weeks ago. He was on for damn near an hour and a half. And just every story from LaSalle, St. John's, playing with Indiana, Kobe Lakers, his how he still feels about not getting drafted by the Knicks 21 years ago. And that was a big funny moment. So just having a guy like him, an NBA world champion, just come on your Instagram live, and when he comes on, then you get like 200, 300, 400 people just watching you and seeing what he's talking about. So that was real cool, real dope, and just we thank you for coming on. And hopefully now with the time we have, we can create more stuff like that on the fly, where people just, it may not be promoted, but if you hop on our live, you might catch a NBA player.
You think about all the things that are going on right now in terms of things that have been postponed or canceled, but every once in a while there's kind of like a feel-good story, whether it's Obadiah Toppin winning the Naismith or getting the Karl Malone Award. And I look at Obi Toppin, just another one of the players that has come through Hoops in the Sun, and he can be added to this list of guys like Kimball Walker, Kenny Satterfield, Push Parker, and maybe even taking some credit for Ron Artest, because when he was at the beach, he was in his prime.
Yeah, so like the story goes where Obi's dad played in the tournament the first couple of years, from like 2000 to maybe 07, and we would see his two young kids always around. But they wanted basketball, they want to shoot around during halftime, they want to shoot around for a prize and everything. So they were always around the tournament, always around basketball. And just seeing Obi now, like he's 6'7", 6'8". If I stood next to him, I'd be like wow, like you really grown up to be like a young, mature man. And he played a couple times at the beach. I think 15, 16, 17 with Bingo's All-Stars. So he was getting, acclimated to high school basketball, and just seeing what he's been able to do at Dayton. And it still feels sad that you just couldn't see anybody in March Madness to see how, if Dayton would have won the championship, and, have Obi's draft stock go higher than what it is now, probably a top 5 pick. But if he played in March Madness, he could have been a top 3 pick. You just never know. But I'm happy for him. I'm proud of him. I even did a live a few weeks ago, and he just happened to, he follows me. He pops in, and I'm like, oh, like what are you, what are you doing here? He said, yo, what's up, man? How you doing? Just checking you guys out. And I think it was on the live with Meta. He said, good to see you guys, and we wish him well and everything. So that's a feel-good story for us to see.
As a commissioner of a very popular street ball league in the summertime that was gearing up to kind of get going around Father's Day in June, what has this process been like for you and your brother right now, also trying to continue the legacy that your father had put together, the late, great Pops Group?
Well, it's crazy, man. Before everything happened, we were scheduled to start June 13th. So you do the math, that's 2.5 months. Obviously, if there's no tournament, then we just got to focus on 2021. If they say maybe August, then I think that's probably too late to do anything as far as running a big time tournament. So we can probably maybe do some 2-on-2 stuff, 3-on-3, a weekend thing at the beach. I don't know, but that's, and the Parks Department have been very helpful with, contacting us weekly, or, this is what's going on, that's what's going on. As you know, they took the rims down at the beach, and they took the rims down at just about every playground in the city. And it's surreal to see that, because Joe and I were just at the beach on Sunday, and I'm looking at the rim and I'm looking, every basket is down. It just gives you a real indication of how serious this thing is. And we just don't know. I wish I could say, listen, we're going to try for middle of June or end of June or early July. You're still 2.5 months out, and I don't want to rush anything either. So if we have to take a back seat to next summer, then I think that's probably the best course of action. It's a weird time living right now. I pray for everybody to be safe, but everything's one day at a time, Bob.
100%. Well, Randy, I really appreciate you coming on the show and sending my best to you and your family. And I'm most certainly hoping that we see Hoops in the Sun in summer of 2020.
Thank you, Bob. Appreciate the invite, and hopefully we can get things rolling this summer. If not, 2021, baby.
Thanks again for coming on, Randy.
All right. Thank you.
Stay tuned. More Open back after this.
next guests are the co-founders of East Bronx Dems Mutual Aid, and they join us for a look at their grocery gift card fundraiser. We welcome Amanda Farias and M. They call her M. M. Torres. We welcome you guys to the show.
Thanks so much for having us.
Thank you so much.
So what do we have? The gift cards, you're putting this in place in light of COVID-19?
Yeah, so initially a bunch of us, myself, Emerita, and a few of our friends, when this started happening, we decided to put together a mutual aid group to kind of find out what resources people might have a difficult time finding, whether that was information from our governmental agencies or elected officials, or maybe even just picking up groceries or going to the pharmacy, or even just finding work, things like that. And we quickly realized that the responses we were getting were more about affordability of groceries and pickup. So that's kind of how and where this came from.
Gotcha. Em, how are you?
Good. How are you? If I can add, I think, one thing to note about the Bronx is that, we're very food insecure. 1 in 4 Bronx residents are experiencing food insecurity. That's about 26%. Also, what we're seeing right now per the New York City Health Department is that the highest number of fatalities per 100,000 people is in the Bronx. So that gives you a sense for how under-resourced we are, both in terms of health, but also the food assistance that's required for the borough.
Yeah. And this is before COVID-19, right?
That's right.
So we've been experiencing, I think it's gotten better. I think the Bodega Association got together with some other organizations and they tried to put the healthier foods in bodegas. Did that help?
I think certainly those efforts have helped. I think the one thing to keep in mind is with COVID-19, this is a pandemic of global proportions. And so the fact that we are already sort of under-resourced, it only makes it even more difficult because we are disproportionately affected. Communities of color, low-income communities are disproportionately affected by this pandemic.
Yeah. When we look at, the people in our neighborhoods that are and how they're being impacted, we're the working class folks that are actually going into the stores and staffing or working at the catering halls or working in the restaurants, doing all of the work that now is shut down. So these are folks that are being directly impacted by the closures, by the shelter in, by New York on pause, right? Whatever we want to call it, and are losing jobs and have to choose whether they're paying rent or they're putting food on the table or they're picking up medicine or, what they're actually doing with their money.
Yeah, essential frontline people, they're exposed to just about everything.
Yeah.
But there's a number of disparities there, but talking about health, it seems like people with diabetes and maybe high blood pressure and degenerative diseases are being affected by it more so than anybody else.
Yeah, that's right. The different comorbidities that people have, for example, you mentioned diabetes, high blood pressure, asthma. These are some of the conditions that so many Bronxites have across the city, not just the Bronx, but I would say, we are disproportionately affected. So as a result, you see that high fatality and you see that high need, that high food assistance need. Yeah. And that's what led us to think about the gift card campaign that we have.
Let's talk about it. What are we doing? How's it working?
So I'll touch a little bit on it, and then Emerita, if you want to jump in too. Okay. We pretty much have used our networks and our own resources to put 5 of our heads together and reach out to people in our networks and ask for them to assist our own neighbors. So it's basically like neighbors helping neighbors. We're trying to put together around $10,000. We had smaller goals before, but quickly exceeded them. So we pushed them up to 10,000 to at least serve 200 Bronx families or Bronx individuals. And we're actually leaving it open for them to tell us where they would like to use that. So we have a great form and application that people can go through. They can either get it through Target, a local supermarket, a Visa gift card. And we also have the option for folks that maybe are taking care of a family member or themselves are sick, that we would get a grocery list from them and do the shopping and do drop off. So we're trying to make this as accessible as possible.
Now, who's helping you guys out with funds so that you can make this happen?
Well, we've been really blessed and really grateful for the amount of donors and people who have stepped up, small amounts, large amounts. We've had people make, $500 donations. We've also had people make $10 donations, whatever people can give, really. And we've been incredibly grateful for that. Neighbors, activists, organizers have come forth to provide these donations.
All right, two things. How do we send money to you? How do we help you guys out? And where do people go to get help for groceries and gift cards and things of that nature?
Yeah, so we actually have our website up. So that's www.eastbronxdems.com. It has the grocery fundraiser link on there, as well as if you need assistance, to click a button and fill out the application.
East Bronx Dems. All right.
Yeah.
Sounds good. Now, speaking of, you're part of the Democratic Club over there in the Bronx, right?
Yes.
Is that right?
Yeah.
So election day is coming. How do we get people ready for election day?
Yeah, so we're hoping to roll out a bunch of information on what does down ballot look like. But we're already seeing that Bernie Sanders has stepped out of the presidential, and how the presidential campaign is now being impacted by that, along with that being a combined June primary. So really about getting people to know what their ballots look like is part of the club's initiative, and making sure we can roll out information on each of those candidates, along with, I think, letting people know that there's a June primary tentatively, right? We're hoping that we can be out in June to vote, but that also might be changed. So we have to keep an eye on that in the future.
The other thing is, campaigning and voting will look different. I think that, the governor announced that you can now vote by absentee. So that's something to keep in mind, how outreach will take place for voters. It's going to be a lot of phone calls right now, given this pandemic, and we want to fulfill social distancing and keep each other safe as much as possible. So the dynamic is going to change. And I think we need to be aware of that and employ new practices when it comes to that.
Okay. What's the website again?
www.eastbronxdems.com.
There you go. Listen, thank you guys so much.
Yeah.
Amanda Farias and Emerita Torres, co-founder East Bronx Dems Mutual Aid. We love you guys. Thank you for all the work that you're doing. And stay strong and stay safe. And thank you for your service. We appreciate you.
Thank you so much for having us.
You too.
All right. We'll be back with more Open next. Unfortunately, that's all the time we have for today's show. I'd like to thank you, our viewers, and our guests for tuning in and checking it all out. And thank you for letting us share in this space and time with you. Tough times don't last, but tough people do. And we thank you for tuning in once again and checking it all out. Always remember this: what you are is God's gift to you, and what you make of yourself is your gift to God. So choose your choice and let your choice control the choosing. The Dr. Bob Lee. I'll catch you over 107.5 WBLS. For all of us here at BronxNet, have a great and enjoyable day. Stay safe. We love you. Peace.